So good afternoon, everyone, and welcome. My name is Melissa Gutierrez. I am the new General Manager at Humanist Canada, and I officially started my role on May 1st. So it's been just a little bit more than a month, and I'm based in Montreal. So I am the General Manager. I have a background in international law with a specialization in human rights, and I've been working in the nonprofit sector for the last couple of years. And today, it's really an honor and a pleasure to be with you to this session and to meet with you all. And I'm also very happy to introduce you to Jackie Nemni, Dr. Jackie Nemni. So Jackie started her career as a mechanical engineer from McGill University before pursuing medical school and internal medicine training at Université de Montréal in Quebec. She went on to complete her respiratory residency at McMaster and has since then spent 30 years working as a respirologist and sleep specialist, including many years in intensive care units across Ontario. Today, Jackie works part-time, focusing her practice on MAiD assessment and provisions, a field where she brings not only clinical expertise, but also a deep sense of compassion and humanity. And in addition to her medical work, Jackie is a Humanist Canada officiant, and she has been part of our community for several years. And she's been married for nearly 40 years. She's the proud mother of 3 grown children and recently became a grandmother for the second time. So welcoming a new granddaughter just last week on May 30th. So congratulations, Jackie.
Thank you.
So please join me in welcoming Dr. Jackie Nemni. And now, Jackie, over to you.
Thank you so much. So yeah, all of those things. I am going to try to give you an idea about the situation with MAiD in Canada, with the caveat that I have only ever worked in Ontario. So you do need to keep that in mind. I will try to share with you the information about the rest of the country, but I don't have any personal experience with the other provinces. Okay, now. So we're going to talk about the legislation around MAiD and the history, eligibility criteria, the current situation, and upcoming changes. So it is important to recognize that this is a moving target. The law keeps changing and evolving. So what I'm telling you today might not be true next year or in a few years, but this is the situation currently. So let's start from the beginning. Are the thumbnails hiding my slides? Do I need to? No? Okay, you just saw my full screen. Okay, perfect.
Yes.
So you probably remember the case of Sue Rodriguez, or at least some of you might. That was in 1993. She took her case to the Supreme Court. She had ALS and she was requesting assisted dying and was denied, actually. And at that time, she said, you know, if my life isn't my own, whose is it? She managed to find, she was in BC, she managed to find a doctor who did help her anonymously, knowing that that was considered murder at the time, but she did find someone who did so. Unfortunately, that person remained anonymous. The next time it went to the Supreme Court was the case of Kay Carter in 2011. And on that occasion, she actually, her case was successful. Now, it took from 2011 to 2015 before it was successful. Things that go through the courts don't happen quickly. It's important to realize that with MAiD legislation, at least until this time, it has all happened by legal challenge. So it's because somebody has gone to the Supreme Court. It has never been that the government says, you know what, we think this is a good idea, or a politician brings it to the table. It has always been through a court order or court ruling. So it became the law of the land in June of 2016. And at that time, all of the provinces had to figure out how they were going to apply this, which was challenging. And some brave physicians jumped in right from the very beginning and started doing MAiD before we really had any idea how to figure it out, what the rules were, what the reporting was to be, etc. So there, I have a lot of respect for those people who believed in it enough to start when it was really pretty tricky. At the beginning, you had to have a reasonably foreseeable end of life. They did not quantify the reasonably foreseeable. So they didn't say, you know, within 6 months or within a year. So that was very vague. And I mean, we all have a reasonably foreseeable end of life. So if it's 30 years, does that count? If it's what's reasonably foreseeable? So it was basically the way that the people enacted it was to say, would you be surprised if this person died of this condition, if you found out they died? So essentially, it was probably about 3 to 6 months that most physicians and nurse practitioners felt comfortable with providing MAiD. Then there was another court challenge. This gentleman, sorry.
Jackie? Yeah, sorry, we hear a little bit of wind right now behind you.
Can you still hear me?
Oh, now it's better. Yes.
It's better? Okay. So the gentleman on the bottom is from Quebec. His name is Jean Truchon. He had a neurodegenerative disease. He was wheelchair bound. He couldn't do anything, really. His quality of life, he said all he could do was watch TV. He couldn't do anything. And he said he didn't think that it was fair that he was not, just Greg, let's leave it open. Sorry. It wasn't fair that he was not eligible. And he challenged that all the way up to the Supreme Court as well. And that's when Bill C7 came into effect. That was March 2021. So you can see already we are coming pretty close to the current times, and things are changing still. At that point, that's where we had the start of what we call the two-track system. And I will explain what we mean by that. So why did I get involved? So as you heard, I was working as a respirologist for many years, did decades in the ICU, and I certainly saw a lot of bad deaths. Dying in the ICU is not a nice way to go, with a tube in every orifice, with not being able to say goodbye, not being able to participate in, you know, any kind of exchange with your family. And I saw really a lot of people who were there whose life we weren't prolonging, we were just prolonging their death, which I found really quite upsetting at times. Not always, obviously, not everybody dies in the ICU, but there are some patients where you know that that's going to be the end. And again, like I mentioned before, we all are going to die. We're a death-denying society. No matter how much money we raise for cancer research or heart and stroke or whatever, we're going to die of something. People don't like to talk about it. People don't like to think about it. People don't like to decide anything about it. People are even reluctant to get a power of attorney or a will. They don't want to think about it, but you've got to think about it. It's going to happen. You know, I've had patients in their 90s who didn't have a will. Like, did you not think that at some point you're going to die? But yeah, people like to pretend, I'm not going to think about it. I'm not going to talk about it. It's not going to happen. And when I realized that the demand for MAiD is growing, but the number of providers isn't, or not enough, I thought, well, this is something that I can help with. I was intending to fully retire. And then I thought, well, I can do this for a while. I can help with this and make sure that it remains accessible, at least in my community. So I followed a few of the practitioners around, did some mentoring with them, and then I did a training program online offered by the Canadian Association of MAiD Assessors and Providers, and participated in a couple of their annual conferences, and that's how I got my start. Any doctor actually is allowed to participate in MAiD, but again, I wanted to make sure that I was doing it right. So where is MAiD allowed? This is the current situation. You can see where, well, it's not quite current. This is from 2015, but it hasn't changed substantially since then. We have some countries in Europe, as you know, like the Netherlands, Switzerland, where it has been legal for a long time, but still in the 2000s. Parts of Australia, not all of Australia. There are some states where it's legal, but in the states, it's only by self-administered pills. It's not by injection, so it's a very different situation. And then there are some countries that are talking about it at present, including France, England, Italy, and they're still talking about it. So I mentioned the two-track system, and so let's talk about the criteria for eligibility in these two tracks. So for track one, you have to be at least 18 years old. That's not to say that children don't die. Unfortunately, sometimes they do, but it's not legal anywhere in Canada at this point unless you're 18. You need to be able to make decisions regarding your health. That doesn't mean you have to be able to make decisions about everything. So you might not be able to balance your checkbook, or you might not be able to cook yourself a meal. But if you are competent to make decisions about your health, and that might be a difficult thing to judge, then you're allowed to request it. In Ontario, you need to be eligible for healthcare in Ontario. And I believe that that's the situation in all the provinces. Certainly, you need to be eligible for healthcare in Canada to have MAiD in Canada, meaning you must be a resident. You can't, like in Switzerland, you can go to Switzerland to have MAiD. You can't do that here. They didn't want MAiD tourism. They didn't want people coming here if it wasn't allowed in their country. You have to make a voluntary request, so you have to make sure that they haven't been coerced, that somebody isn't pressuring them into doing this. They have to give consent, obviously. And at present, the primary condition is not solely a mental illness. And death is reasonably foreseeable. Again, like before, reasonably foreseeable doesn't get quantified, but usually people accept about 6 months as a maximum. And we're not very good at predicting that. So when we think 6 months, we might be way off. People often will say, the doctor gave me a year to live, and here I am 3 years later. It's because we don't honestly know. We make an educated guess, but we don't have a crystal ball to know exactly. The criteria for track 2, so this is where death is not reasonably foreseeable, they are essentially the same. So you need to have a grievous and irremediable condition. And that's the case in track 1 as well. So if you have something like chronic pain, rheumatoid arthritis, you have to have attempted by some means to treat it. So for example, if you have chronic pain due to arthritis and you haven't seen a rheumatologist in 20 years, or you haven't taken any medications, that's not considered eligible. So, but it is subjective. You may have seen a rheumatologist and said, I don't care for what they're offering me. So there's track 2 are the cases that cause the most headaches, the most press. Oh, that's my dog, sorry. And the most concern, whereas track 1 generally are fairly straightforward. And we're going to come later to the numbers, and you'll see that the track 2 are actually pretty rare. So again, they get a lot of press, they get a lot of bad press, but they're not common. So how do we assess for eligibility? I just wanted to mention too, if you have questions or you want to jump in, I'm happy to address them as we go. Or if you want to wait till the end, that's fine too. And Melissa's going to be monitoring the chat. So if you type a question in the chat, that's fine. Or if you want to unmute yourself and ask a question, that's okay too. So 2 independent assessors have to make your MAiD assessment. Independent in the sense that we don't share our results or our assessments with each other, but we typically know each other. I mean, Guelph is a small community. That's where I am. We're a small group of people who do assessments. We know each other well, but we try to keep it distant. We don't share our assessments until we have both completed them, to try to make sure that they remain independent. Let's say one person finds the patient eligible, the second does not. They're allowed to request a third assessment. And if they can find 2 people who find them as eligible, they're good to go. Some people will ask 3, 4, 5, 6, 7 times, and then we run out of assessors. So sometimes you need to actually bring in an assessor from a different area. Chances are, if a lot of people are finding them ineligible, it's because nobody's going to find them eligible. They need to sign a request, and they need to sign that in front of an independent witness. So somebody who doesn't have any skin in the game, so they can't be on the person's will. They can't have any kind of benefit to this person dying. So usually it's a friend or a neighbor. Sometimes it's a healthcare professional. It can't be one of the assessors. It has to be somebody else.
We have two questions.
Yep.
Yeah. So one of them is presumably the assessors must be doctors.
Doctors or nurse practitioners. That's at least that's the case in Ontario. Again, I'm not sure about other provinces, but that's what it is here, and I think probably elsewhere as well. But those are the only two who are allowed.
Okay. And then how does a criteria? How does one initiate a request for MAiD?
So around here, and I think in many communities, we have a coordination center, a care coordinator, and the requests go to that care coordinator, who then puts out the requests to us, to the assessors, to see if somebody will do it. There are some areas where there are no care coordinators, and sometimes then the request is made directly to the assessors. It works much better if you have a care coordinator, and usually you can find out how to make the request through your health system. So here it's the LIN or whatever they call it now, but you have to find out if there is somebody who's coordinating these requests. In Ontario, there is a form online that you can print out, and you don't have to do it with a physician. You can do it as an individual and then ask for that assessment. So look online if you're in a different province, look for requests for MAiD wherever you are. And most of these are found online.
Okay. And then we have another participant asking if you work with Dying with Dignity.
I do not, but certainly we are, of course, well aware of their existence, and they're a great organization. They were amongst the people who really fought for MAiD. Were very vocal in that fight, because it has been a fight. Every step of it has been a fight. Anything else?
Not for now.
Okay. So the patient, as mentioned, has to give consent, and they have to be aware of the alternatives. So for example, we discussed the fact that they could go to a hospice. They could stay at home, get care without getting MAiD. They could get palliative care. They could get palliative care at home. They could get it in the hospital. They could get it in a hospice. So we discuss what are the other options. And they have to give final consent. Now, this is a little bit complicated. So when we ask somebody if they want MAiD, they have to be able to say yes. We tend to repeat that question many, many times. Both assessors, of course, will ask that question. They have to make sure that the person is consenting. And the way that the law used to be read, it was that you had to be able to say yes on the day of. So the day that the MAiD provider arrives, you still need to be able to say, yes, that is what I want. Oops, I keep doing that. We'll get back to that in a bit.
Okay, I do have another question here. So someone is asking, they say, I am a certified humanist chaplain, and I work in my health society supporting MAiD requesters and their families on Vancouver Island. We have many tracks to MAiD requesters and recipients of MAiD. So it's a comment. Yeah. Okay,
great. For track 2, so we're talking about people who do not have a reasonably foreseeable death. You need to have somebody who has expertise in the condition that they are suffering from. And that might not be, the assessors might not have any expertise, and then they have to find people who do, which can be a big challenge, especially if it's a rare condition. And you have to document very carefully that you have looked into and really researched this condition and show that this person has exhausted the options that are available to them and they are not getting relief. It is, again, a grievous and irremediable condition. There's nothing that's going to make it better. And you have to offer other ways to alleviate suffering. Usually, if they've gotten to this, they've tried everything that they could think of. For track 2, there's a waiting period of 90 days. So from the day that you get first assessed to the day that you have MAiD is at least 90 days. For track 1, it could be tomorrow. If once you are approved, it can be right away. There is no waiting period and there is no waiver of final consent available. So the waiver of final consent. So again, track 1 only, reasonably foreseeable death. This came about because of this woman in the picture, Audrey Parker. She had breast cancer and she had metastases to her brain. And she was very concerned that she was going to lose capacity for MAiD on the day before the day that she chose it. And she said, it's not fair that now I'm going to have to choose to die before I really want to die because I'm worried about losing capacity. And she made that challenge. Unfortunately, she died before the case was heard at the Supreme Court. But eventually it was accepted that you could waive that final consent. So again, you had met all the safeguards before the loss of capacity. You've had your 2 independent assessments. They have agreed to the fact that you are eligible, and then you've lost capacity. For example, you bleed into metastasis in the brain. Or one of the things that happens fairly commonly, especially in people who are dying of cancer, is that they are on a large dose of pain medications, sometimes to the point where they're barely rousable and they can't really answer questions, and they certainly don't look like they're competent to answer your questions at that point in time if they're too groggy. It seems unusually cruel to withhold the pain medications in order to wake them up and ask if they still want MAiD. And that's basically how the challenge was won at the Supreme Court, was by saying that people were suffering unnecessarily because they were reluctant to use their pain medications because they didn't want to lose capacity. Now, on the day that you show up, even if they have lost capacity, they can no longer consent. But if they see you coming and they say, no, or they push you away, so they give any verbal or nonverbal cues that they no longer want MAiD, then that's it. It's over. You cannot proceed. It can't just be that they twitch when you insert the IV or something minor like that. But if it really looks like they are not consenting, the waiver becomes null and void and you can't proceed anymore. They're not going to have MAiD, unfortunately. So how is it performed? Again, as mentioned, this is something that's different in different areas. This is what we do in Ontario, and I think is probably fairly standard, not in the US where it's oral. You have to recognize then if you have to take a large overdose of pills, if you have ALS and you can't swallow, or I don't know, throat cancer, and you're not able to take pills, or whatever your condition is makes it you don't absorb pills properly, then it's not going to work for you. Whereas with IV medication, pretty much everybody we can find a way to get an IV. The nurse inserts the IV. We start by sedation, and the person generally falls asleep, and that's the last thing that they remember. Then you give medications that induce a coma, and we give those medications a very large dose until they're at a point where we could perform surgery if we wanted to. You could have your appendix removed, you wouldn't feel it. And we make sure to verify that the person doesn't respond to pain in any way. Sometimes at that point they die. sometimes they don't. The next step is we give a medication that causes muscle paralysis, which affects the diaphragm, and so they stop breathing. It doesn't stop the heart, even though the heart's a muscle, but it has a different chemistry to it. And usually, if the heart hasn't stopped, it stops within a couple of minutes. So the whole process takes around 10 minutes. It's very quick, it's very peaceful. There's no struggle, there's no gasping for air, there's no reaction whatsoever. It just looks like the person fell asleep. So for the family, it tends to be a very calm, quiet, loving experience. Most people are very happy with how it occurs. Obviously, they're not happy that their loved one died, but they are relieved to see how calm they seemed, and it's what they wanted. And so they're very relieved that they were able to offer their loved one the death that they wanted. So where is it performed? This is also different depending where you are. I have majority of the ones that I have been active in have been at home, usually in the living room, not generally in their bed, so often in their favorite lazy boy or in their backyard if they want, but only if it's very private. It can be at a hospital. It can be at a funeral home. Some funeral homes have a space that they keep just for that purpose, or it could be in hospice, but not every hospice allows it. In fact, the Guelph hospice didn't until about 2 weeks ago because of very persistent, intense activism on the part of the team of providers here. This was before my time that they really started this, and they had to be very, it took a long time, but it has happened. Unfortunately, there are some hospitals which will not allow it, and they claim a religious exemption. So they say that, for example, any hospital where the name starts with Saint, so here we have a St. Joe's, there's a St. Mary's in Kitchener. If the name starts with Saint, they're not going to allow MAiD. St. Joe's here in Guelph is the chronic care hospital. So of all the places, it would actually make a lot of sense that they would provide MAiD, but they won't. So you have to put that poor person on a stretcher, find a bed to admit them to the Guelph General Hospital, get an ambulance to take them across town to a place where they can have MAiD. And this seems like an absolutely ridiculous, unnecessary complication. Imagine somebody who's in a lot of pain and they have to get bumped on a stretcher into the ambulance or whatever. There is a current court challenge in British Columbia saying that they cannot, asking to end this religious institutional objection. They're saying that even though you're whatever, a St. Mary's or a Saint whoever, you're not providing religious care, you're not providing mass, you're not providing I don't know, Bible study, you're providing healthcare, which is a federal and provincial funding, and as such you don't get to claim religious exemption. So we'll see. That it hasn't even come to court in British Columbia yet. We don't know what the results are going to be, but the hope is that if they win and they cancel the religious exemption in British Columbia, that the other provinces will follow suit, because they will probably recognize that if the challenge is made in their province, that they will also lose, and why waste the money? But who knows? They might not win. We don't know how that case is going to go. But that's the situation at present. So there are many places around the country where you cannot have MAiD. What is in the media makes me ill. It's a bunch of lies, really. There's a lot of misinformation and fear mongering. It's really quite unbelievable. So the picture here, this is an interview with Jordan Peterson, And they describe MAiD in Canada as like torture, and that we paralyze the patients before we give them any sedation, and that the patients drown to death, and that they are struggling to breathe, and that it's atrocious, and that somehow we're hiding this information, and that if there had been an autopsy, that they would find these lungs full of fluid, that the medications that we use are like the medications for death by lethal injection in the States, which is absolutely false. They're talking about medications which are never used in Canada, but this is kind of the state of what's going on in the media. And these little paragraphs that I have on the right show another thing that you will see a lot is people saying that people are requesting MAiD because of poverty, or because they have poor living conditions, or food insecurity, or whatever. And of course, poverty makes people have suffering. Nobody is going to claim that there is no suffering involved in poverty. However, you remember that the way the law is worded, it says you have to have an irremediable condition. This would be remediable with money. I don't know where they're going to get the money. It's not my job to find them the money, but it's not an irremediable condition. So you will see articles that say so-and-so had MAiD because she couldn't get a subsidized apartment. Well, I would be very surprised if any MAiD assessor agreed to that. Maybe she did have MAiD, but it's because there was something else. It's not because of that. There could be poverty, there could be suffering that goes along with that, but that cannot be the reason for the request for MAiD, or if it is, they're not going to get approved. So
I have a few questions.
Sure, of course, yeah.
So we have a participant asking, why would organization in the US spread fear mongering about MAiD? Why do you think they are against it?
I wish I knew. It's a lot of it is the same people who are against abortions. So it tends to be very right-wing, redneck. Is that insulting? But people who they see it as murder. There are no situations in which they think it is acceptable. I think it's again a little bit of death denial. I think that if they lived through a difficult death of a loved one, they might not feel the same way. In the same way that there are people who will shoot and to kill an abortion doctor, there are people who make death threats to MAiD providers. So it is for some people, it's a core value that there are no situations in which it can be acceptable. Obviously, I don't agree. And I think if you think about it, when in my years in the ICU, when we would have somebody on life support and withdraw life support, we are actively ending their lives if they are dependent upon it. And that's not considered MAiD. That's just considered taking somebody off life support. There are shades of gray that are perfectly legal. It's really almost a semantic distinction. So a lot of people will say that those who provide MAiD are have a God complex, that we are acting like God. And my opinion in this situation is that God is the one, if you believe in God, who's trying to kill you. And so, when we provide chemotherapy or when we provide dialysis, why isn't that we're playing God? I mean, if God wanted to save you without chemo, that should be entirely possible. So everything we do could be interpreted as interfering with God's will. I don't see this as being something vastly different from what we do every day as physicians. But that's where it is. And there are some people who are anti-MAiD who they will never, ever change their minds. There is absolutely nothing you could say or do that will ever make them believe that it's actually a kindness. That's the reality. In the same way, exactly the same as the abortion debate. So, in the same way that the anti-abortion crew will do anything to stop you from having an abortion, but will do nothing to help your newborn or the mother. It's just there's this sanctity of life, but only to a certain extent, and not to help that person, only to protect being alive. I don't know if that answers the question. It's a very difficult question to answer because obviously I don't share that opinion at all. And I wish I could say that the public opinion is changing. A vast majority of the Canadian population agrees with MAiD. I think it's over 80%. So things are changing. Definitely, things are changing. In the same way that the percentage of the population that self-reports as being non-religious has increased over time. So there has been a shift, but there are some completely unreachable. And we won't talk about the states because it's a little bit of a gong show down there. And if anything, it's going to go backwards, not forwards. That's another reason why I have become involved, is because I think we need to appreciate that this could be taken away. It's a law that we have now, but laws can change. So it's not a given that this is going to remain something that we have access to. I really hope that it is. And the public opinion, as I say, supports it. So it would take a lot for it to change in Canada, but it's going to change in the States. I think we're not going to see any progress there.
Mm-hmm. And what do you think are the biggest reasons why MAiD haven't been adopted more widely around the world?
It's very complicated. It is complicated. It's ethically fraught. You have to make sure that you're doing it carefully, that you're doing it in a way that there's not what, as they call, the slippery slope. Many people think that when we brought in Track 2 in Canada, that was a bridge too far, and that the slippery slope has been reached and we are sliding down it at rocket speed. I don't believe that, but I do think that those are the challenging cases and that you have to be extraordinarily careful. At the beginning, when MAiD was first adopted in Ontario, the MAiD provider had to sit with the patient and call the coroner and wait for the coroner to call them back for every single solitary case. As time went on and people became more comfortable, more familiar, now the coroner gets notified, but you don't have to wait for the coroner to call back. The coroner reviews every single case of MAiD, whether they be Track 1 or Track 2. They can sometimes request more information. They they can sometimes say that there were things that were done not right and request that there be a change in the approach or the treatment. So it's complicated. What is happening is that countries are copying other countries. So the more countries have rules and watch each other and see how it goes, they learn what's going on in another country and choose how they are going to approach it based on that. Like the fact that in Canada, they said we're not allowing it for out of country citizens because they didn't want to become Switzerland. So I think gradually, I mean, there are some countries it'll never happen, or not in my lifetime. But I think amongst European countries, I think it will gradually spread, I think. We'll see. Time will tell. And again, sort of the questions about poverty there, and I don't want to belittle that. It is very important. And there's no doubt that there are societal ills that we can't fix. So, and as a MAiD assessor, you can't fix them either. If I see that somebody's situation is really unbearable, and I agree that it's unbearable, but it's because of potentially fixable things, well, they're not eligible.
Mm-hmm. Another participant says, I have CTL, chronic lymphocytic leukemia. So far, so good, but track 2 MAiD is on my table, and my rheumatologist understands. The problem is my family won't come to the table. My sister have power of attorney, and one refused due to her religious beliefs, and the other doesn't want to talk about it. Is this a common problem? I would love to have them on board rather than exclude them.
Yeah, it is unfortunately a common problem. A lot of us have somebody in the family whose opinions, religious, political, whatever, are vastly different from our own. The way that the law works for MAiD is that it has to be the person involved, the person who makes the request. That power of attorney cannot. So it doesn't matter what your power of attorney thinks. You and you alone make the decision. It's nice to have your family on board. You don't even have to tell them. It's your decision. Some people don't tell them. In Ontario, this is not the same across the country. When we fill out a death certificate, we do not put MAiD as the cause of death. We put whatever it is that led them to it. So if it was lung cancer, then your cause of death is lung cancer. So even if the family requests the medical information, it won't show there, and it might be an issue in terms of the insurance. So again, it's not there. And it is true, your cause of death is the thing that brought you to it. That's why you didn't choose to die. The thing that I didn't mention, and I should have before, the wording changed. You may have seen it referred to as assisted suicide, and that is not considered appropriate. It's not like these people decided, you know what, I want to die. They are dying, at least for the track ones, and they're just changing a little bit of the how. They're not changing the if. They are going to die, and they would rather not. If you say, would you rather not have lung cancer? Well, duh, of course. But this is where I am. The chemotherapy hasn't worked. It's spreading. My pain is increasing, and therefore I would like another option. So it's not assisted suicide. I hate the term MAiD because when I tell people I'm a MAiD assessor, they think I'm doing house cleaning. It's not that kind of MAiD. So it's a strange term, but it's what it's evolved to. The concern again is about the disenfranchised, the poor, and there's a lot of talk in the media that as if we're preying on, like we're going into parks and we're dragging homeless people and making them have MAiD. There's no death squads going around looking for people that we can provide MAiD to. These are people who come to us. Information is being gathered about ethnicity. They get information about their financial situation by their postal code. You can tell a lot about somebody by their postal code. And I'm just showing you these stats that show that across the country, I mean, the numbers are small, but in some of the provinces, because they're small provinces, but the number of Caucasians is well over 90%. So if anything, this is a bit of a white privilege situation more than it is that minorities are being targeted. I think we have to look at why it's so strongly white is actually not normal. That's not the makeup of the population of Canada by any stretch of the imagination.
Another participant who says the media reported a story of a woman who was offered MAiD due to her chemical sensitivity, which caused her a distress. She was exposed to cleaning agents in her apartment building, and she could not afford to move. Could this be considered an irremediable condition due to her circumstances?
Again, no, because if she could afford to move, the problem is fixed. So it could now, you might find an assessor who finds you eligible. I'm not saying that everybody would not, but if money would fix your problem, then you should not be eligible. That's the law, really. It has to be irremediable. The concern that has arisen in Canada is that there's quite a steep increase in MAiD in Canada, and it's gone faster than it has in the other countries where it's legal. Where are this line here? So it started in 2016 and it has climbed quickly. I think perhaps, this is me speculating, in part it's because people at this point were already on board. So it increased quickly. Whereas when you start way back here, and as I said, in the US, it's all oral, so you're not going to have a huge uptake. When you start a long time ago, maybe there was a longer time for it to become acceptable to the population. It tends to level out somewhere between 4 and 5% in most countries where it has been legalized. People look at this graph and they extrapolate it to infinity and say, there you go, eventually 100% of Canadians are going to die of MAiD. Obviously, that's not going to happen. It's going to plateau. But for now, this is what it looks like. And it has continued to grow beyond 2022. This is Ontario. And by 2023, it was at about 4%. And again, this kind of steady climb that's not showing a lot of leveling off. I think the fact that we added on the track 2 in 2021, that caused a little bit of a jump because there were people who wouldn't have been eligible who became eligible. It's going to likely plateau. Now, here it is per province. These numbers here, I put this together from different federal documents. So it's not an official count. This is me kind of trying to get an idea of numbers from all different sources. But this is for 2023. All of the provinces, obviously you get to PEI, it's a small province, the numbers are small. So the thing that has people a little bit concerned is this number here. So this is the number of MAiD deaths total. This is in thousands, so number of deaths in that year, about 79,300 deaths. So of the deaths in Quebec in 2023, about 7% were MAiD. That's the highest reported in the world. And nobody really knows why it's higher in Quebec. Quebec's always been a distinct society, and they're distinct in that regard. They are trying to look into why is it higher in Quebec. Maybe it's because Quebec has rejected religion quite vehemently. So maybe there's more public acceptance than there is elsewhere. But that is an issue that is of some concern, and it's being investigated. Obviously, Canada's a big country, and if you live in the territories or you live some of these, oops, sorry, can I get it to go back? As opposed to, Southern Ontario and Quebec, you don't necessarily have access to providers, to a place to have MAiD. So it is far more accessible along the strip of the border than it is elsewhere. That's healthcare in general in Canada. And I don't know how you change that. There are not a lot of people up here, and there are not a lot of doctors, and there are not a lot of nurse practitioners. So that's going to be a challenge to make it more evenly accessible across the country. I know you probably can't read these numbers, but just to give you a general idea, again, this is Ontario. It's similar across the country. 67% of MAiD deaths are for cancer. That's the vast majority. The next biggest would be neurodegenerative. So things like ALS, for example, is a fairly common one. You get some grab bag of other things. You get some respiratory deaths, people who have advanced COPD. You get some cardiovascular ones, people who have heart failure that can't be treated, or it's just getting worse and worse, and a mishmash of other things. But the majority tends to be cancer.
A quick question from the participant. What step should one take regarding MAiD if one is in the early stages of some type of dementia?
Can I defer that talk to this slide, actually, we're getting to that.
Okay.
Right now, when you are in the early stage of dementia, there's nothing much you can do depending on where you live, unless you live in Quebec. And we're going to discuss that right now, actually. So the federal government did mandate that the law was to change and mental health as a sole condition would become eligible for MAiD. And that was to happen in March of 2023. And there was a bit of an uproar from the medical community saying, no, we're not ready for this. So it got postponed to 2024. So that's not much better. We're still not ready for this. And now it has been postponed to 2027. So whether it will actually come into effect in 2027 or whether it's going to get deferred again remains to be seen, but that might happen. Now, you recognize that people should have exhausted their care options. And if it's anything like what it's like right now, mental health care is hard to come by. And it's certainly hard to come by a psychiatrist. And in many cases, you can only get mental health care from somebody who you pay. So in that situation, we're very concerned that only people who have the means to afford therapy are going to be able to apply, because if you haven't been able to access therapy, you can't say that you've exhausted your treatment options. So I don't know how that's going to play out. In countries where they have allowed mental health, I think it's Belgium, the numbers are tiny, very tiny. And a lot of the people who apply, the majority of people who apply are not considered eligible. But it's going to involve a ton of resources, which we don't really have. We don't have them for people without requesting MAiD. So I don't know how this is going to actually play out.
Is there a process to right now to make mental health conditions reason for someone to, like a eligible reason for someone to get
Well, yes,
access to MAiD?
that's what I was mentioning. That has to be, that will come in 2027, maybe, unless it gets postponed again.
I think we have a George who would like to, you can unmute yourself.
Are you on the beach? No.
Hi there.
Hi.
George and I are together, and he's 94, and we're a member of multiple things like Ontario, Toronto, the Hat People, and so recently I gave a talk where I presented various things about MAiD and how, according to a lot of the international media, it's being abused in Canada. And we're the most liberal Western country for this.
Yes.
And so the thing is that we live in a place, George and I, and we're seeing this firsthand, that they're coming in and they're, the PSWs, like, there's a lot of politics, like they're all giving it. And like they're coming in to kill them, and then they're calling the ambulances and the police.
What are you talking about?
Well, what about your neighbors who all called for MAiD, George?
They were both suffering from painful
Hold
cancer.
on. Okay. So, George, you can come out here and talk to me. Remember? Okay.
Yeah, don't bother these people.
So certainly a PSW could not provide MAiD. So that's the start. If the patient hasn't requested it and hasn't had the proper assessments and been found eligible, they can't have MAiD. So yes, there is a lot of talk of this, or there's a lot of rumors that spread. If somebody hasn't shared information about what happened to them, I think it's unlikely that the scenario is what people are saying that it is. So again, PSWs, I've heard of people saying that their physiotherapist suggested MAiD. Maybe, but they are in no situation to assess or provide. So whatever they have said to them doesn't carry any legal weight. So I don't think that there is going to be a flood of people getting MAiD, certainly not against their will. And if that's happening, then that MAiD provider and assessor is doing something illegal.
We have a
You're muted.
participant saying, I have been volunteering as an independent witness ever since MAiD was legalized. I think you have done a superb job of providing an overview of the MAiD landscape.
Fuck. They're all prevented.
Oh, sorry about that.
Okay, obviously not a fan. Let's
yeah.
talk about advance directives, which have become legal in Quebec just recently. And that is that other question that you shared a few moments ago with what can you do anything with early dementia? So for the vast majority of the country, the answer is no, you can't. For unless you are in an advanced state, a grievous and irremediable condition, in an advanced state of decline, that's another part of the wording, you are not eligible. And a lot of people would very much like to be able to have an advance directive to say, if I get to the point where I don't recognize my children, or I'm unable to care for myself, or I can't wipe my own bum, or whatever, they want to have the option to have MAiD, but it's not legal. Is it going to become legal? Probably. We don't know when. In Quebec, they have adopted it, but in a kind of a soft way, where somebody like myself, I can't say I would want MAiD if I get advanced dementia, which I hope I don't have now. You have to already have the condition for which you're requesting MAiD. So you already have to have the dementia and in a mild state. And if you get to where it gets to meet the criteria that you have dictated, then you can have MAiD. So you have to draft a statement with a medical health professional that lays out in a lot of detail what the conditions are. So, I can't look after myself. I don't recognize my children. I lose the ability to play tennis, whatever. You can make the conditions what you think would make your life unbearable. And if you meet those conditions, then you would be eligible for MAiD. If you change your mind over the years, you update your advance directives, that's allowed. It's complicated. Those advance directives in Quebec are stored in a provincial repository, so that, for example, if a patient gets admitted to a nursing home, they can look up whether or not they have an advance directive on file, because it could possibly be, right, not yet because it just came into effect, but down the road it could be that your advance directive is 10 years old or 20 years old, and the physician who you crafted it with is retired or dead. So it needs to be something that can be followed up with whoever's looking after you at the time. So it's complicated. It's a multi-page document that would be very difficult for many people to complete. And if you show up to provide MAiD, all the conditions have been met, the patient is now demented, they don't recognize their family, they have all the criteria that they said, but they don't show any evidence that they're suffering. And we do know that there are people who are what we call happy demented. They don't recognize people, but they're going to the art class and they're singing along to the music or whatever. If there's no evidence of suffering, you cannot proceed. And if they show any evidence of resistance, then you cannot proceed. And that's it. The advance directive gets ripped up and it's finished. Now, the criminal code has not changed. The criminal code is federal, not provincial. So it's not legal. It's not legal in Canada, but they have used the notwithstanding clause to say that the providers will not be prosecuted. Personally, I would not feel comfortable in that situation with the criminal law not having been amended. So that's basically the current situation. Again, it's brand new, and I think it's going to be helpful for us in the other provinces to see how things go and what they learn from their process in Quebec in order to change our own laws. So things might be a little bit different in the next few years. And at this point, if there are more questions, I'm happy to answer them. That's all that I had, like, as a formal presentation.
Thank you so much, Jackie. There is a few questions. How does one volunteer or help in any way advancing for MAiD?
That's a great question. You can certainly look at what's available in your community. Like the other person commented before, you can be the witness to help for somebody's request. You can volunteer with Dying with Dignity is another way. You can't get involved in the assessments or the provisions unless you're a physician or a nurse practitioner. However, you can be a support person for the family. There is a support group. Now having a little memory lapse here, the name of it, but it's something like for the family of family and friends of patients going through MAiD, and it's a support group for people who really it is a challenge, and it's a bit of a challenge to be left behind. There's no doubt that for the person who requests it, they are absolutely relieved, happy. The reaction that you get when you tell somebody that they are eligible is one that, in my experience, of relief. A lot of them don't end up having MAiD. They might die of their underlying condition or whatever. They might end up in hospice, and that's how it happens. But they are just so relieved to know that if they want it, it's an option. For the family and the friends, they might feel like, well, maybe they died prematurely. Maybe they could have lived a bit longer. And what about my suffering? I'm suffering that they're gone. So that could be a challenge. It's also very weird and a bit surreal to know the day that your loved one is going to die. You know, we're not used to that. We don't know what to write on the calendar on that day. We don't know what to call that day. And it's an odd feeling, one that people struggle with, you know. And then how does it actually happen? So when I schedule a provision, I tend to do it in the morning if possible, or because I feel like spending that whole day just waiting for it would be really odd or difficult. That being said, in my community and in many, the nurses who provide MAiD, that's not their full-time job. There's not enough of a demand for that. So they often have a full-time job, and then they can come and do the IV starts in the evening or on the weekend. So you also have to go with who's available. You can have trouble finding nurses who are interested or willing. You can have pharmacists who have a moral objection and who don't want to participate. We have one pharmacy that provides the medications. When you're doing a MAiD provision in hospital, there are some pharmacists who do not want to be part of that. And you are allowed, everybody's allowed to be a conscientious objector and does not have to participate if they don't want to. So you have to also make sure that the pharmacist who is on is interested in going ahead. So there are a lot of issues about the scheduling. Again, there aren't enough MAiD assessors or providers. We're fortunate in Guelph that we do have enough. We can generally get somebody assessed relatively quickly. That's not the case everywhere around here, and it's often not the case, as I mentioned, in remote or smaller communities. There are some communities, some where there's a strong religious belief, you know, some Mennonite communities around here where the population is not in favor, and it would be a real challenge. So then you might have to go somewhere out of your area. Yeah, so it's the question about getting it. It's we try to do the best job that we can. If there's somebody who wants to be assessed as quickly as possible, we can usually find someone. That's not always the case. And as the population ages, as the baby boomers get old, it's going to get worse. So there's going to be probably an increase in demand, and that's certainly what we're seeing, without necessarily an increase in supply. That might become a challenge.
Yeah, absolutely. I think Martin Fred had his hand raised. You want to unmute yourself?
I should be. Can you hear me?
Yes.
Hi, Jackie. Thanks for a great presentation. In fact, I was just at a celebration of life for someone who had a MAiD death.
Okay.
And so I've been fortunate enough to be at a few of MAiD deaths. So listen, the question that I had was really pragmatic because I know you're semi-retired, but so the provision, you've already touched on it around the provision of the medication. Who actually provides that? Do you have to be connected with a hospital as a provider, or do families have to organize that, or how is that organized?
Yeah. So I can only speak to my area and in Ontario. The medications are provided by a community pharmacy, and then they are generally delivered to the location where the MAiD is going to be provided. They don't need to be refrigerated, so it's relatively easy to have that box get shipped. If it's in hospital, yes, it comes from the hospital pharmacy. The MAiD provision is free. There's no cost to the patient or to the family. The access to the medications, again, if in a remote area, you might not find a willing community pharmacy or hospital. So I'm sure that that's a challenge in some areas. It isn't here. We have one pharmacy that provides them all, and they're excellent in terms of, if you say we have a provision for next week, they will set it up. It's a much bigger challenge if the patient, I see a patient on Friday and they say I'd like MAiD on Monday. Well, though I'm not going to have time to get a nurse and to get the medication. So we can't, it's not a quick process, and MAiD is never urgent. It's not an emergency. If it's an emergency because you're having a pain crisis, then it's a palliative care emergency. So treat that pain crisis. It's never urgent to provide MAiD. And in fact, one should consider that it's a well thought out and careful process.
Great, thank you.
You're welcome.
I have a question. How does the MAiD assessor assess that the witness was in fact an independent witness when the patient was making the application for MAiD?
Well, you look at who they are. They have to identify who they are. So they're a friend, they're a neighbor, they're whoever. If it's a family member, we won't generally accept that. Even if they say, I'm not in the will, say, well, no, that's not good enough. So a little bit as we take it on that they're being honest about who the person is. The witness and the requester have to sign on the same date. So you have to make sure that they actually did witness the signature, that they didn't fill out their request and then a week later have somebody sign it. The same for trying to assess whether or not they were coerced. If you have any doubt, for example, you think that it sounds like they're not fully on board with this, one of the strategies is to ask to speak to them alone. Usually when you go to do a MAiD assessment, they have somebody with them. They have a family member, they have their spouse, they have somebody with them. But if you have concerns, you can say, I'd like to speak to you alone. You are under no obligation to complete an assessment in one meeting. So if you do an assessment and you have some concerns or some questions, you can say, I'm not done. You can investigate whatever you think needs to be investigated. If you think you need to find out more about their underlying health condition, you can take the time to do that. You can consult with specialists. You can make a request to obtain their medical records from whatever specialists they have seen. So some people, their assessment can take multiple visits because you have some concerns. The ones that I've been involved with have generally been really quite straightforward, and it's very obvious that the person is making their own request, and they're kind of desperate. It's very clear that this is what they want. So I haven't had situations where I've really been worried about that.
Well, my only comment is though I have never been an independent witness, I did apply to become one many years ago in Ontario. And when I was looking at the forms, I decided that I could not be an independent witness because of the way the form was laid out because it said I was witnessing on behalf of the patient.
Yeah.
And I said, no, I'm not. And the law was eventually changed. But I haven't become an independent witness yet. So I encourage anybody who's becoming an independent witness to look very carefully at the wording. And one question that was never answered satisfactorily to me was, I wanted to have the ability to ask the patient that, do you want me to be your witness? And that was never made clear to me in that I could ask that question.
Okay.
That
Well, the role of the witness is simply to witness the request. It's not your job to think, are they going to be found eligible or not?
Oh, no, I appreciate that. I appreciate
Yeah,
that.
or even if it's a reasonable request, you're just saying this person is asking me to document that they have signed this form. That's all.
Yes, but I appreciate that. But asking me of their free will, not under duress. And
That's not your job. That is not your job. That's our job afterwards to come and find out whether or not this was done with free will or under duress.
Then I would be very reluctant as an independent witness then.
You're just simply witnessing the signature of the request. That's all. It's not your job to determine whether or not it was why it was requested.
No, I take from a medical standpoint, I take your standpoint, but if you're going to witness a will, for example,
yes,
if you think somebody is signing under duress, you're not going to witness it. In my view, that's my view anyway.
Yeah, yeah. I don't think
I think it's a very sensitive. I think it's a very sensitive area, and independent witnesses have to think very carefully about it as to how they're carrying out that function.
I'm not a lawyer, and I wonder maybe if somebody in the group is a lawyer, could they answer that question? Is there a lawyer in the house?
I was many years ago, but
Okay.
I'm not giving legal advice here.
Okay.
Thank you. Jane?
Thank you. My question is about Alzheimer's. And, since it's a diagnosed deterioration of the brain, the physical brain, why is that considered a mental illness?
It is not considered a mental illness.
Oh, good. Okay.
Considered a neurodegenerative disease. So no, it's not excluded as being a mental illness. However, if you just have mild dementia, you might live another 10, 20 years. So you wouldn't be considered eligible just because you're not at the point where you're close to death. So if you have Alzheimer's to the point where you're unable to swallow, okay, well now this is going to impact the length of your life, or you're bedbound and you're getting bed sores or something else. In the same way that if you have COPD, but it's very mild, yes, it's a condition that could be a reason for MAiD, but not in its mild forms.
So track 2 wouldn't work for somebody who was miserable in that they are not able to communicate. And
yeah. So they'd have to be able to communicate enough to make their wishes known. That's still the law.
Yeah.
And you have to be in an advanced state of decline, right? Advanced is the terminology. So there was a case that the coroner reported on recently in Ontario where somebody did a waiver of final consent that we discussed. And they made that when you sign a waiver of final consent, you have to specify a date. So you say, I want MAiD on September 1st or before, even if I'm unable to consent. So if you go along and on September 1st, you're still fine, okay, you rip that one up and you say, okay, December 1st. And if on December 1st, you're still fine, you rip that one up and then you say, okay, March 1st. And so these can go for a long period of time, but most people, and the interpretation of the law is that you shouldn't really do more than 3 to 6 months in advance. So the case that went to the coroner was somebody who had signed a waiver of final request. I think it was 5 years hence or something. So they said, that's not a waiver of final request. That's an advanced directive, and that's not legal. So it's a little bit of a of a question of interpretation, but the way that I understand it, and I think the way the law intends it, and I might be wrong, is that in order to sign a waiver of final consent, you need to be eligible for MAiD now. So you have this condition. If you asked, I would like to die tomorrow, we'd say, okay, all right? And if I come tomorrow and you can't speak anymore because you've had a stroke and you can't consent, that's okay, because we've signed that waiver. An advance directive is that you're not eligible now, right? You have mild dementia.
That's the thing. You can't predict that
No.
it's going to be so bad. You'd like to
Exactly.
not have to go through
I know,
that.
I know. We'd all like to, but it's not legal yet.
Thank you very
if
much.
If you're not eligible today, and you can't say, well, in 10 years. So right now, that law
Okay.
is very likely to change, as it has in Quebec, but for the rest of the country, it has not changed yet.
Very good. Thank you.
You're welcome.
Perfect. And then I don't see any additional questions on the chat, but we can take maybe one more. It's not that I have a question. I also wanted to ask Jackie, in your experience, what has been the most, or like the particular challenges that you've seen, you know, or like trends that you're observing? Is there anything in particular you would like to share?
So far, I've been pretty lucky that there haven't been any really difficult cases, but I've certainly heard from my colleagues about some very challenging ones. For example, like what was mentioned by somebody earlier in their question, where the patient is very determined to have MAiD goes ahead, and then a family member who isn't in agreement finds out about it, and then, you know, comes back and says, you know, you murdered my father, or whatever. It's none of their business. It's the law. You didn't do anything illegal, but it can be very, very challenging and upsetting, obviously, for everyone involved. I think what we are kind of stuck with where the law is, and most of us are very careful that we want to make sure that all the T's are crossed and the I's dotted, and we're doing everything legally. I will do what's permitted by the law. I'm not one of these people like Morgenthaler who's willing to push beyond the law to make a statement that I think the law should be changed. I won't do that. I'm too chicken to do something like that, and I don't want to go to jail. But there are people who push the boundaries on purpose because they are challenging the status quo. And I think those people are, sometimes they are very brave. I think sometimes they are a little cavalier, and they are risking a lot. So yeah, you kind of, I wish, for example, that the advance directives were possible. I went to assess somebody this week, and she presented me with a list of all of the conditions under which she would want MAiD. You know, if she had intractable pain, if she couldn't recognize her family, if blah, 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 a whole long list, but none of them were true now. And I said, well, I'm sorry, like I can't do anything with this list. I understand why you've made it, and I too would want MAiD under these circumstances. Store that in your filing cabinet, and if the law changes, then maybe we will revisit this list, but for now I can't do anything with that.
Yeah.
And she was very, she understood, but she was sad. And she said, you know, I want you to promise me that you're going to be able to help me. I said, I can't promise that. I don't know. She might lose capacity before she becomes eligible. That's the situation that we are in right now. But again, you know, it started in 2016. That is not that long ago, or it's not even 10 years.
Exactly.
So it's new. There's a learning curve. There's an acceptance curve, which has gone very well by the Canadian population. So things are going to change. Things are going to evolve. We're going to learn. There are going to be mistakes. I think that's something that the media focus on as if medical error can't happen ever. Of course it happens. We make mistakes in every field of medicine. We try not to, and sometimes those mistakes can be very significant, and they can change procedures, they could change the law, whatever. But could it happen that somebody had MAiD and it really probably wasn't appropriate? Yes, of course it's possible. There are many, many, many safeguards to try to prevent that from happening. But that doesn't mean that it's infallible and that everybody's going to agree. Not everybody's ever going to agree to anything.
Yeah, exactly. Because everyone has their own perspective too. We're all humans. Yeah. I will have one last question from a participant. How are MAiD providers selected and approved?
I can only speak for Ontario. Again, I don't know how it works in the rest of the country. Essentially, if you are willing and you are a physician, then you can be a MAiD assessor and provider. There is no requirement for any kind of special training, but most choose to do so. The challenge with MAiD is not medical. The medical aspect is absolutely simple. And at the MAiD conferences, we never talk about that aspect because that's not complicated. The complicated part is ethical, it's legal, it's making sure that you understand the nuances, that you are making a full assessment of all of the things that have been mentioned, of capacity, of voluntariness, of irremediable decline, of all those things. You have to have really carefully done your homework. So if you have chosen to do MAiD, I think again, I'm speaking for myself, and I am probably judging based on my own experience, but most of us would have a great fear of doing it wrong, and that's what motivates you to make sure that you understand what you're doing, that you understand the law. This Canadian Association of the Medical Assessors and of MAiD Assessors and Providers is a great resource. They are the ones that have put together this training package. It's not mandatory to do it. It's free to do it. So why wouldn't you? And it's online, so it's available everywhere. As a group, I can speak for my own group. If you have concerns, if you have questions, the other members of the group are more than willing to talk about it. We get together, we chat about issues that may have arisen that we are wondering how to deal with. And I think almost everyone will err on the side of, if you have any doubt, any concern, your answer is no. Nobody would go ahead and provide MAiD if they have any nagging doubt, if they have any concern. I think, again, I can't speak for the entire population. And could there be some cases where one person would decide one way and the other another? Yes, that actually happens frequently, because it isn't black and white. But most of us are really trying to do our absolute best to do what is legal, but also what is in the patient's best interest and what they actually want. So very long answer to a simple question, which is that you just need to be a doctor.
Jackie, thank you so much for sharing your perspective and your experience and this very important topic. I find it incredibly helpful and valuable, and I'm sure that everyone here also really enjoyed this session. It is a complex topic, to say the least, and you really helped to make it more understandable. So thank you so much for your time and for being here. We very much appreciate it. And I also want to thank everyone for participating in this webinar. Thank you for your questions, for your active listening. So I hope you also enjoyed the session. And there is a short survey at the end of the Zoom call. So please take a few minutes to just answer the little survey, and enjoy the rest of your day, and see you soon.
Thank you very much.
Thank
Bye-bye.
you.